The first step was the realization that what we knew in terms of us as experts was not sufficient to solve the problem. And so the first part of finding a solution was to include in the conversation about the problem the people we were actually working with, the people on the street. We've tried taking you to the hospital. We've tried getting you into these programs. We've tried getting you into a alcohol or drug treatment program, and it hasn't worked. What can we do differently? You tell us what would work for you. And the person would say, isn't it obvious? I need a place to live. And as strange as that may sound, because it's so painfully obvious, that was not a route available to them. The only way into housing was through treatment first and then housing. So having realized that the solution was about direct access to housing, step two was to create a vehicle for providing that service, create an agency, Pathways to Housing, get a grant that had money for rent and support services, and then go back to those people on the street and offer them what they wanted most, a place to live. While that seemed obvious and simple, it had not really been done before. Taking someone on the street that was visibly using or symptomatic and giving them the opportunity that they were desperate for, asking for, a place of their own to live, required a suspension of our own anxieties and our own sense of we're liable, you know, what's going to happen, because it was a different level of risk, you know, a level of risk that many, certainly the hospital system wouldn't take, and certainly many housing providers or other programs don't take. Programs like a lot of control, especially with things that they're afraid of or don't understand, like mental illness. So it does require that you suppress your anxiety and you allow the person an opportunity to live in an apartment. We didn't know how that would turn out. We didn't know how it would turn out for the person we were bringing into the apartment. And because we were renting from the private market, there were other individuals, families, old people, young people there, kids. And so it was, you know, fingers crossed, we're going to let this person have a shot at housing. And we were very diligent about visiting. I mean, you know, it's housing first, but it's not housing only. There's a lot of support in this program, and the support is in the form of a visit from one of the staff, especially in the beginning, the first weeks, every day. How are you doing? Everything okay? How's it working out for you? So there was a real, you know, kind of to manage our own anxiety and to support the person. Both. We saw them a lot. It worked out spectacularly well.